The next category of changes relates to managing the patient's airway. The AHA has incorporated several new recommendations into the 2010 guidelines. The first is quantitative waveform capnography. Waveform capnography monitors the amount of carbon dioxide exhaled by the patient. It's the most reliable indicator of endotracheal tube position during cardiac arrest. It also serves as a physiologic monitor that provides information regarding the effectiveness of chest compressions, ROSC, and adequate coronary perfusion. The guidelines recommend using waveform capnography to verify the placement of an endotracheal tube. Scientific studies have not yet validated waveform capnography as a method of confirming proper placement of other advanced airways. However, effective ventilation through one of the other advanced airways should produce a capnography waveform. A normal CO2 waveform looks like this: 0 levels in the early phase of patient exhalation. At point B, the first amount of CO2 arrives at the sensor, followed by a sharp rise in CO2 levels. The CO2 concentration during exhalation eventually plateaus. Point D represents the highest concentration of exhaled CO2 with that individual breath and signals the beginning of the inspiratory phase. This phase produces a dramatic fall in CO2 levels. Rescuers can also use waveform capnography to monitor CPR quality and detect ROSC based on end-tidal CO2 values. If the rescuers are effectively ventilating the patient, ineffective chest compressions will produce a low end-tidal CO2 reading. In contrast, ROSC can cause an abrupt increase in end-tidal CO2. Other recommendations that relate to managing a patient's airway during cardiac arrest include cricoid pressure. Do not routinely use cricoid pressure during cardiac arrest. Studies show that this technique is difficult to master and may not be effective at preventing aspiration. It may also delay or prevent the placement of an advanced airway. Agonal gasps are not effective breaths and should not be confused with normal breathing, delaying important life-saving interventions.